Hey, greetings, class. I am really thrilled for today's guest. Her name is Jennifer, and she's a social worker, and she's at KU Med, and the sirens were just going off, so I don't think we recorded the sirens. But if we did, hey, it's action, it's life, it is what it is. So we're going to talk today, class, about Medicaid expansion, and Jennifer's thoughts about Medicaid expansion. This is clearly an area of interest that's important to her, but I'm going to let her share with you all why that is so meaningful. So Jennifer, please introduce yourself to everyone.
I'm Jennifer McCabe. I am a licensed clinical social worker here in Kansas. And yes, I work at the University of Kansas Health Systems. I've kind of worked all over in the health systems, but right now I'm working in the cancer center in stem cell transplant, so blood and marrow transplant. I grew up in Colorado, and I went to school at Baker University, not too far away there from Lawrence, and went to grad school in San Diego and graduated from San Diego State with my master's, and then came back to Kansas to practice social work. And I've worked at the KC Care Clinic, and I've worked here at KU for a little over 12 years now. So a lot of experience recently in my career in healthcare. And I think kind of moving around from different states has given me a good perspective too on how healthcare and access to healthcare is different in different states. California has Medi-Cal, and they have much looser restrictions for who qualifies for Medi-Cal compared with some other states.
So why is Medicaid expansion important to Kansans?
Mm-hmm. I think it should be important to everyone. Having a safety net for citizens to access healthcare and have good healthcare that's affordable is important to everyone. That's never been more evident than during this pandemic.
Oh, absolutely.
If your neighbor, if your mom and dad, if your child's preschool teacher, if the clerk at your grocery store has symptoms of COVID and can't get access to a test, doesn't have primary care, is worried about going to the emergency department because of costs, that affects everyone, because that person can get really sick and they can also infect everyone around them. So that's one huge reason. But I personally, working in healthcare so long, feel like healthcare should be a right. It's not something that's only available to those with connections and with wealth. It should be a public service available to everyone. If the fire department comes to put out your house fire, they're not going to ask you for your fire insurance. They're going to put out your house fire. And I really feel like healthcare should be the same.
I think that's a great point. One of my good friends, who's a veteran in Dallas, he has a similar position. Housing is
absolutely a right.
Housing is the same thing. It's a right. We should all have somewhere to call home at the end of the day. So I think you're absolutely right. When the fire trucks show up, they don't ask for your fire insurance. They just put out the fire. And I know with the current health crisis, that we also see the impacts of social determinants and parts of the state where there are maybe low income families living, have no healthcare options. Sometimes we would say those are food deserts because they don't have healthy food, but they also don't have access to healthcare in those same areas. So it's healthcare deserts and food deserts, and it's just a desert.
And that's one other good point, that with Medicaid not expanding in Kansas, rural hospitals are struggling, and 4 of them have closed in recent years. If they don't have revenue, they don't have paying patients, they cannot stay open. So even if you had great insurance or you had Medicare and you're having a heart attack, the nearest hospital might be too far away for you to access, even with insurance. So it affects everyone.
Absolutely. I happen to be on business with Blue Cross and Blue Shield down in southern Kansas, and watched literally a wrecking ball take out a hospital. And
wow.
the providers, the Blue Cross and Blue Shield providers of Kansas, they were just like, our closest hospital now is in Kansas City. I don't know what we're going to do for our patients. And this was just, down near Pittsburgh, Kansas. I mean, it's not that far away. So
not far.
Absolutely.
But if you're traveling every day to appointments, like when there are cancer patients, that's far away. That's a lot to travel, and there's not resources to stay overnight, and
that's just unreasonable and undoable. So what have been some of the barriers to Medicaid expansion? I'm sure one of the obvious barriers is all about the money, but And any other thoughts on barriers?
Well, I think it's so easy to jump to the money, but it's important to know that the federal government subsidizes this Medicaid expansion at 90%. So they're only asking the state governments to pay 10%. And I think that many business leaders, many healthcare organizations have come out and said it's fiscally responsible for us to expand Medicaid. That it actually provides a lot of jobs if we expand Medicaid. It expands access. It takes care of patients who otherwise wouldn't have a payer source. So I do think that is an easy thing to say, but if you look further into it, it makes more sense fiscally to expand it. I think the biggest barrier that I've seen is politics. I think we've come really close in Kansas a couple times to expanding Medicaid, and every time it's been just a couple people that have a lot of power that have put up a roadblock.
And it really raises several really, I think, important points. One that popped into my head real quick, if I can retrieve it here, was preventative health care saves money.
Mm-hmm.
If we had Medicaid expansion and patients were able to go before they were sick, preventative health care,
Absolutely.
10% that we might have to spend, we'd save that on the back end.
Absolutely.
10 times fold. So how does that not make sense? And I don't think, social workers, we're not known for our, our economics or our math skills. But even then, if a politician is going to get stuck in the mud about finances, I don't see how they don't understand that.
Yeah.
But, right. It then boils down to, people not wanting to work across the aisle. And
right.
So how long do our citizens have to just wait? Right.
Yeah. And I do think people have worked across the aisle. I think that's part of what's so frustrating about expansion in Kansas is in 2017, they passed Medicaid expansion and it was vetoed by the governor at the time. And just this last spring, they had bipartisan supported and sponsored bill by Governor Kelly and Jim Denning, and they still weren't able to push it through despite having a bipartisan collaboration. So it is really frustrating. It really does highlight the importance of voting in local elections. Local elections matter. They're huge. They're not sexy. You might not hear a lot about them, but they make really important policy decisions for the patients that we serve. And if we're going to say that we want to be responsible for those most vulnerable, we have to kind of get involved in policy.
Absolutely. I am a firm believer that we have to be involved. And not everybody maybe has quite the same ambition to, run out and impact policy.
Yeah.
I know when I was a policy student, I've shared this on another video. I prayed to the policy gods, could I just pass this class? I'll let policy be for other people that are smarter than me. But I have learned that as a social worker, as an LCSW, I can't avoid policy.
Yeah.
Policy is what allows us to have practice. And so if we are going to ignore it, and voting is the ultimate policy advocacy.
And I'm right there with you. Before I went to grad school, I did not want to be involved in politics at all. I wanted nothing to do with it. And I had a policy class in grad school, and I learned it is everything. And since then, practicing in healthcare, it's everything. It's so important. And as a social worker, you can't practice and not be touched by policy, and your patients are too.
Absolutely. So, Jennifer, there's this certain petition that's out there that's kind of maybe got your name on it a little bit. I thought it was really cool when I went and looked at it. I got it shared to me from one of my colleagues, and I was like, that is awesome. Something really important to her. She put forth the effort, maybe had to figure out some, internet, gizmos to make this work.
Yeah.
So share with my class how you were inspired to create a petition.
Sure.
And I will include the links in my class notes so my students go out and check it out.
Like I said, this spring, we had an opportunity, I think with bipartisan support, to pass Medicaid. And I really thought that would be a reality for Kansas this spring. I have not been involved in doing petitions or call to actions before. But like I've said, kind of working in healthcare and working in cancer and seeing patients who their care is delayed because of access to healthcare, I just realized it's so important. And what really spurred me to action was there was a group of nuns that actually had a petition that they signed and sent to the legislator. advocating that Medicaid is a moral responsibility for us. And I thought if the nuns are doing that, then as social workers, we really need to have a voice. And it's one thing to say we're behind it, but I think we really need to be vocal about that and express that, it's important to us, it's important to our patients and the residents of Kansas. So
well, yeah, that's the simple part, right? Actions speak louder than words. And
right.
It's one thing to say you're a social worker, but you also have to have the actions to back up that
right.
you're a social worker.
Correct. And I think we part of our creed is that we're committed to taking social action and advocacy on behalf of our patients and our vulnerable populations. And so that I think is easy to get lost when you're working in direct practice, and it's easy to become overwhelmed with just the day-to-day tasks. But it really is nice to kind of take a break from that and look at things from a more macro level and get more involved on that level too.
Absolutely. That's one of the secrets of being a social worker. I always tell when I meet undergraduate students at Missouri Western, where I teach full time, and they're kind of on the fence about social work or counseling, I'm like, hey, we're skilled to look at the picture from 30,000 feet and 3 feet, and we can shift gears back and forth. And we have to be able to do that because policies affect us at 3 feet and at 30,000 feet.
Right. Yep. So it was not a solo operation, this petition or call to action. I definitely had some mentors along the way. I had some colleagues here at KU that helped me in kind of reading everything with me and adding to the petition. And Sherry Hilger with Social Work PRN has been a huge mentor and help with that, as well as Becky Fast. And I don't know if you guys are familiar with Becky Fast, but she's a social worker with the Kansas NASW, which is also a Johnson County Commissioner here in our county.
Right, absolutely. I know both of those individuals.
Yep.
So, all right. Well, thank you so much, Jennifer. I don't want to hold up. I think you and I could probably talk for another 30 minutes, but I'm not sure our students would want to hang in there for another 30 minutes. So thank you so much for being a part of class and being able to share some of your knowledge. I will include the links to the call for action. And if there's anything else that you think is relevant, if you send me a file or two, then I will include it in the readers for my students.
I will put a plug in here. The group doing the majority of the advocacy for Medicaid expansion is the Alliance for a Healthy Kansas. And they're also on the link for the petition. But if students want to go on there and sign up, they can get regular emails and updates regarding advocacy opportunities for Medicaid expansion.
Hey, that is an excellent tip. So appreciate that so much.
Thank you for having me.
Thank you, Jennifer.
Thanks.